Okay, the recommendations for screening mammography, as stated by the American Cancer Society, American College of Radiology, and Society of Breast Imagers, is that for patients with average risk of breast cancer, that they begin screening at yearly intervals at age 40. The cutoff time for when you should stop screening really depends on comorbidities that the patient has, meaning that additional disease factors that may be at play. If somebody, we have patients that are well into their 80s that have no other illnesses, and if we were to find something on screening mammography, they would certainly be able to proceed with treatment if we found something. But if you have an elderly patient that has other disease factors that would put them at high risk to go ahead with doing something about a finding that may occur on a mammogram, then you may want to stop screening at that point. Obviously, if there was a clinical finding, you may pursue it and then decide what to do about it once you have that finding. Now, the reason I say that it's a little controversial in terms of the screening is that in 2009, a task force was created to evaluate when screening mammograms should be done. And they came to the conclusion that there was no benefit in women between age 40 and 50 to screening, and that screening should begin at age 50 every 2 years and end at age 74, which is kind of an arbitrary cutoff. But again, what we basically go by, American Cancer Society, American College of Radiology, and Society of Breast Imagers, based on our findings and a lot of data that has come out, there is definitely a benefit of screening women 40 to 49 average risk. Now, in high-risk women, you could begin screening as early as age 30. And it's not recommended by any particular society to start before age 25, but certainly in high-risk women, it's a benefit to start at age 30. Diagnostic breast ultrasound is used to evaluate a mammographic abnormality in most cases. A woman will come for a screening mammogram. We'll have her come back. We may see an abnormality on the mammogram. We'll have her come back, do additional mammographic images, and then based on a finding on the mammogram, such as an area of distortion in the breast, if we see a mass, we'll do a diagnostic ultrasound targeted to that particular area of the breast in an attempt to better characterize the mammographic finding. Sometimes in young women, as I said, who were not doing screening mammogram, they may come in with a palpable mass in the breast, and we will go to diagnostic ultrasound to evaluate the character of that mass and to see if it requires further investigation, such as a biopsy.